Structural heart diseases encompass problems with the valves of the heart and problems with congenital birth defects such as atrial septal defects or ventricular septal defects, which are colloquially called holes in the heart. The Structural Heart Diseases program at Samaritan involves interventional cardiologists, cardiac surgeons, and general cardiologists, all of whom work as a team to take care of patients with structural heart problems. One of the most common problems is narrowing of the aortic valve, also called aortic stenosis. Patients with aortic stenosis usually get told that they have a heart murmur. They may experience symptoms such as chest discomfort, shortness of breath, lightheadedness, fatigue. Frequently, patients will attribute these symptoms to just aging. Patients usually get referred to us from their PCPs if they're found to have aortic stenosis on their echocardiogram, which is an ultrasound of the heart. And we have the cutting-edge technology and state-of-the-art operating rooms needed to perform procedures such as open heart surgery to replace the aortic valve, or to do transcatheter aortic valve replacement, also known as TAVR, in our hybrid operating room. Frequently, aortic stenosis is treatable and patients can go back to living healthy, fulfilling, active lives.